The chair lays out House Bill 5166 and recognizes Representative Morales-Shaw to explain her bill.
Chairman Frank, Madam Chair Rose, thank you very much and members for allowing me to lay out 5166. This is a bill that is about language access. Every session, we work hard to make sure that Texans get something in return for their hard work, the tax dollars. These are our friends, our neighbors, our employees. Every good Texan should have access to the things that we provide to them every session. It might be in the form of health services, that we make them aware of. It might be grants and other community resources that we put and we have our Texas agencies administer online, and their public-facing information. But what good does all of our work do if our neighbors, our friends, our employees don't have access to that information and they can't take advantage of it? And I highlight health information specifically. I won't make this long and drawn out because there are people here today that will testify. But I would like to, if you would give me the privilege to just ask the public to show a show of hands of the people who are here who traveled all night to come to the Capitol in support of the bill. Don't worry, they're not testifying. But I would like them to raise their hand. Thank you. These folks traveled all night starting at like 3 a.m. to be here this morning. So I thank them for coming, and I'll remain open for any questions. This bill is asking HHSC to make sure that they have a language access plan so that all Texans can have access to the information that we work hard to provide to people. Otherwise, they won't be able to take advantage of it. And I remain open to questions if you have any, and I reserve the right to close. But are there any questions?
Yeah, members, any questions? All right, thank you, and thank you for bringing it to us this morning.
Yes.
And we do know, and I asked in terms of limited testimony, and I really appreciate that. We have this is a very important bill. We want to make sure we discuss it, but we also have, I think, 17 other bills on the floor today and other things, and so we appreciate you all cooperating in that regard. Chair calls Terry Yoon. And I've got you as Terry Yoon.
Yes, sir.
Testifying for self and for Woori Juntos.
Woori Juntos.
Woori Juntos.
Yes, Spanish
all right.
word.
And for the bill, is that correct?
Yes, sir.
Okay, thank you very much. Go ahead.
Should I start? Okay.
Yes, absolutely.
Yeah, dear Chairman Frank and committee members, my name is Terry Yoon, and I'm a service coordinator with Woori Juntos. I'm here to testify for HB 5166. I assist first-generation senior, low-income, and limited English proficient Koreans navigate and access health and human service benefits. This includes serving as a Korean English interpreter, translator between my clients and the agency, helping file Medicaid or SNAP benefit applications, and educating them how our health system works. I will share a case story that exemplifies just how much of a barrier language is to accessing these benefits. I have been helping a 64-year-old Korean-American immigrant, Ms. M. She has multiple health issues and has not been able to work over the last 2 years. Her doctor told her without her heart medication, she could die. Turning 65 soon, Harris Health sent her to the Social Security Administration to apply for Medicare. SSA told her to bring her birth and marriage certificate and divorce decree. Not born in the U.S., she came to Woori Juntos seeking help. We assisted her to order her birth and marriage certificate from Korea through the Korean consulate in Houston. The documents we received were in Korean, though, so we translated into English and had it notarized for a certificate of accuracy of translation. Ms. M's divorce was filed by her ex-husband by publication out of state. Since he would not provide her with a copy or inform her what court it was filed with, we researched and called numerous courts in the state where he lived to finally locate and obtain Ms. M's final divorce decree. We spent many hours calling, writing, emailing between these agencies and communicating on behalf of Ms. M. But finally, the proper documents were turned in, and Ms. M got her Medicare, renewed Harris Health financial aid, got interviewed for supplemental Social Security income, and she's waiting for her case determination. Once she is approved for SSI, we will help her to apply for Medicaid and food stamps. Before coming to Austin, just yesterday, I called 911 for Miss M because she was showing symptoms of a stroke and she could not call 911. She's been admitted to Bentop Hospital and was told that she came just in time. This is just one case out of dozens where without my assistance, language barriers would have prevented access to care. Also, this is why it is so imperative for Health and Human Service Commission to create a robust language access plan so someone like Ms. M, who may be eligible but is not English literate, can take control of her life to rely less on others for help and be able to achieve more freedom. At the very minimum, translating your Texas benefits in the languages under HB 5166 will provide a huge relief to my clients and save Health and Human Service Commission money in the long run. So please vote for yes on HB 5166. Thank you for your attention to this important matter.
All right, thank you very much for your testimony. Members, any questions? Yes, Representative Ramos.
I have more of a comment. Thank you, Ms. Yoon, for your work. And as many of us know, those of us who are bilingual, I know every time I go to a baptism, to any family event, people are waiting to ask me questions because Spanish speakers and there's not access to information. And so we serve as the informal sources for a lot of these agencies and this information. And we have to get on the computer and explain things to people at birthday parties. So having that information available and accessible, I really appreciate your advocacy for this. There is a huge need for this, and I appreciate the facts and the data by district that you broke down in your handout for us, because it's very important that we support these Texans who are also taxpayers and contributing to the greater pot and the greater good. So thank you for your advocacy.
Thank you, Ms. Ramos.
All right, thank you very much. Members, any other questions? Yes, Representative Manuel.
Hello, good morning, and also thank you for being here. How do you run into people who would normally go for services, but they're so intimidated they just won't even ask for help, even though they deserve to be getting that help?
Yes, there are people, especially if they're not socially have a good network, like their church or their friends, then it would be even more intimidating for them to come seeking help. I've had people call from hour away from Corpus Christi who couldn't speak English, and he needed to do this and do that, and so he's called me. I'm helping him over the phone.
Thank you so much for being here and helping people.
Thank you.
All right, thank you very much. Members, any other questions? All right, thank you for your testimony. Chair calls Katia Martinez. And then I've got Wafa, I'm not going to try that, is on deck. I've got you as Katia Martinez, self.
Karla.
Okay. Well, do we have your permission to change it? Because it's Katia in here.
Yes.
So, okay, we'll change it to, it's Karla Martinez, self, for the bill. Is that correct?
Correct.
Okay.
Oh, sorry,
Thank
it's
you.
for every Texan, not for self.
Oh, we've got you in there twice then. So
Is there somebody named
is
Katia
Is-
Martinez?
is there someone named, I'm assuming there's not a Katia Martinez then for the bill. So we've got you,
It's a different person.
maybe it's either a different person, I'm not sure. All right, then I've got you, I'll go Karla Martinez for every Texan for the bill. Is that correct?
That's correct.
Okay, thank you. Go.
Thank you. Medicaid and SNAP are essential programs that provide vital services to low-income Texans that are eligible for these benefits, helping them access the health and food benefits that they need to maintain their health and well-being. But many Texans who are limited English proficient hit a lot of barriers when they're trying to access these benefits that they are eligible for. More than 1 in 3 households in Texas speaks a language other than English, and 13% of Texans have limited English proficiency. Language barriers can prevent pregnant women, parents, or hurricane survivors from completing applications accurately and in a timely manner, ultimately leading to delays or denials of benefits. Texas cannot reach all eligible children and pregnant women if Medicaid, CHIP, and SNAP applications and their accompanying information is only available consistently in English and sometimes Spanish. Pre-pandemic data show that at least 400,000 Texas children were uninsured in 2019, making it harder for them to get access to medicine and mental health support and more. Bills passed by the House this session and last help remove barriers so that kids who are eligible today for Medicaid and CHIP can get their checkups. But we can't reach these children if we're only providing applications and related materials, if we aren't providing those materials in languages that their parents speak. Texas House also recently passed 12 months of postpartum coverage for new moms. To ensure that all Texas mothers and their babies have the best chance at staying healthy, we need to remove language barriers that prevent pregnant women from accessing Medicaid and SNAP. Currently, when a non-English or Spanish speaker calls 211 to go through a series of prompts in English to request an interpreter to potentially get connected to one. By providing written materials in additional languages, Texans can have information about program requirements in these commonly spoken languages. These one-time investments can save money in live interpretation and ongoing staff time. LEPs are common nationally and are used in other state agencies, including Texas Commission on Environmental Quality, Texas Department of Transportation, and the Texas Supreme Court. As a daughter of Spanish-speaking parents, I understand firsthand the need for translation and interpretation services so that parents know what they're attesting to when they're submitting these benefits. By passing HB 5166, we can ensure that all Texans, regardless of language proficiency, have access to the critical social services that they need to maintain their well-being.
Okay. Thank you very much. And I'm assuming in the translation, we're talking written translation, right? I mean,
So translation is written and interpretation is oral. So translation would be written materials, and interpretation would be somebody helping translate the language I'm speaking into the language that somebody else could understand it.
okay, I'm confused and I get that way a lot, but so if the documents have been translated, the person's not reading them, there's then an oral?
Yeah, so the documents have been translated, somebody can read them. An interpretation would be like me calling and asking to be connected to somebody that can understand and speak my language so they can interpret it to another language.
Okay, gotcha. Different situations then.
Right.
Okay, all right, thank you very much. Members, any other questions? All right, thank you very much for your testimony. Chair calls Wafa Alayrakche. I'm guessing I wasn't very close. And is this the translator?
That's the translator.
And I would like to acknowledge the translator, Rania El Bitar. I get closer on that one.
And she has a spelling mistake. I mean, can you just make sure that we're allowed to change it?
And I've got you as Wafa.
Alayrakche.
Would you mind spelling that
Yes.
so we make sure we have it right here?
It's W-A, F as in Frank, A, and then the last name A-L-A, T as in Tom, R-A-C-H-E.
Okay. Okay.
A-C-H.
Thank you very much. And we show you as for the bill, correct?
Yes, correct.
Okay, go ahead.
حضرة المسؤول فرانك وأعضاء اللجنة.
Dear Chairman Frank and the committee members,
أنا اسمي وفاء الأطرقشي.
my name is Wafa Alayrakche,
أعيش في هيوستن تكساس
and I live in Houston, Texas.
وأنا أدعم HB 5166.
I support HB 5166.
أنا أريد إدخال اللغة العربية
I very much want the Arabic to be included
في كل خدمات ولاية تكساس للصحة والخدمات الإنسانية.
for all Texas health and human services and application.
أتيت إلى الولايات المتحدة مع ابني من العراق عام 2012 بسبب الحرب.
I came to the United States with my son in 2012 because of the war. in
وقمت
Iraq.
بكل ما أستطيع للعمل حتى وأقدم لعائلتي احتياجاتهم من مأكل ومسكن وصحة.
And I did everything I could to provide my family with basically the basic needs they need to live fairly in a good position by cleaning.
ومن ضمن الأعمال التي قمت بها أعمال التنظيف في الفنادق والعمل في الأفران.
Among them is cleaning in a hotel and work in bakery.
ولكن بسبب عدم قدرتي على التكلم على اللغة الإنجليزية بطريقة جيدة واجهت بعض الصعوبات.
But because of limited
I'm sorry,
English-
ma'am, will you mind standing a little closer to the mic when you talk? And then
Because
chair recognizes Representative Shaheen as present.
Okay. So, and because of my limited English proficiency, I faced a lot of challenges.
واجهت بعض الصعوبات وبسبب مدخولي المحدود لم يكن لدي سوى خيارات قليلة فيما يتعلق بالضمانات الصحية.
And with my limited income, I had barely little options as when it comes to health benefits.
وعندما حاولت تقديم طلب السناب والميديكيت واجهت صعوبة.
And when I tried to submit application for SNAP and Medicaid, I wasn't able to. It was really challenging for me.
لأن الطلبات لم تكن باللغة العربية وهذه كانت مشكلة وعندما تعرضت
And it was really hard for me to submit those applications because those applications were not in Arabic, and it's really hard to comprehend all the technical terms on these applications.
وكانت الطلبات عدة نسخ ليست نسخة واحدة.
And you know how it is, forms comes in different parts, so it was really hard for me. It's too much form to comprehend and fill out those applications on my own.
وكذلك عندما تعرضت للإصابة في الفندق.
And when I had an injury in the hotel.
وذهبت إلى المستشفى كان من الصعوبة علي أن أفهم ماذا يقول الأطباء.
And I ended up going to the hospital, and it was really hard for me to communicate and understand what the doctors are saying.
لأنني أدركت أنه كان الأطباء كانوا يقولون لي.
But eventually I figured out on my own that the doctors were trying to tell me
أنه يجب علي أن أخفف من حركة كتفي حتى أستطيع أن أشفى.
They recommended me that I need to decrease my motion in my shoulder so I can recover quickly.
بينما أنا المفروض كان يعني المطلوب من عندي في العمل بأنه أشتغل أكثر.
But because of my job, I was supposed to move a lot and do a lot of work because I work in a hotel.
إضافة إلى ذلك قد اقترحوا علي إجراءات للمساعدة في الشفاء.
And on top of that, they recommended me to do go have some other procedure that could help me basically recover faster.
لكن كان علي أن أدفع التكلفة الطبية من جيبي الخاص.
But it's gonna be something that I had to pay out of my pocket, and I couldn't afford it.
ولكنني لست أستطيع لأن ليس لدي المال.
And of course, I didn't have the money back then to go through all these procedures.
مع الوقت لمدة 3 سنين تعافيت من الإصابة في كتفي.
And it took me about 3 years to recover from my injury in my shoulder.
ولحسن الحظ بوجود الأصدقاء.
But because of the help of friends.
وقسم من المنظمات مثل منظمة أوليفر برانش.
And other organizations, for example, the organization of Oliver Branch.
الذين كانوا يتكلمون العربية والإنجليزية.
And that organization, they have people who speak both languages, the Arabic and the English.
ساعدوني بملء الاستمارة الطبية أو ملء استمارة السناب فود لي.
They helped me fill out the application for the SNAP and the Medicaid.
ولهذا حصلت على السناب والميديكيت.
And that's how I got SNAP and Medicaid.
في اسمين يعني without الأصدقاء والمنظمة أنا لا أقدر أسوي فود ستام ولا ميديكيد.
And without the help of the friends and the organization, I wouldn't be able to apply for Medicaid and SNAP.
وإنه من المهم جدا بطلب التصويت بنعم.
And it's very important for me if you all vote on
HB 5166.
On HB 5166.
شكرا جزيلا.
Thank you so much.
Okay, thank you very much. Members, any questions? Yeah, Representative Manuel.
صباح النور.
Morning.
How easier would it have been if she would have had you would have had the translations to be able to do it on your own rather than waiting?
شو كان بالنسبة لك إذا كانت الترجمة كانت موجودة بوقتها صار معك الحادث، لو كانت هالأشياء موجودة هالطلبات بالعربي كانت أسهل لك أحسن ما تكوني تسألي لحتى تساعدك أشخاص آخرين؟
أكيد لأن كانت ربحت الكيسة أنا استخسرت الكيسة تبعتي كان أقدر الفندق يعطيني تعويض هسه الفندق ما نعطاني أي تعويض.
If everything was in Arabic, it would be easier for me to communicate, and I would have win the case actually because there is a case between where she works at the hotel, and because of the communication and lack of Arabic for her she lost the case, and they didn't pay her anything after the injury that happened to her.
And how difficult was it for her to go from a country where they didn't have these kind of services to having them here to try to understand what the government was supposed to be helping her with.
وشو الفرق بين انت بالبلد مطرح ما كنتي مثلا بالعراق انه هالاشياء هيدي ما كانت موجوده عندك هونيك وهون جيتي لهون ولقيتي هالخدمات هيدي كلها موجوده، شو الصعوبه يلي واجهتي فيها، شو حسيتي؟
كلش قوي الإحساس لأن هناك أتكلم لغة عربية فمن أحكي ويا الدكتور أو أحكي ويا المحامي أحكي باللغة تبعي. أفتهم إنجليزي بس أكو قسم من مثلا المصطلحات صعبة علي أفهمها.
So back home, even though they don't have all like they provide here, but the communication is easier, like to get what you want because everybody speaks the language. But for me here, it was really hard to communicate and get the message through. When it's like English for me was really hard at first. But
Islamo.
Thank you very much.
So how long have you been, I think you said it at the start, how long have you been in the United States?
عم يسألك من أي سنة أنت جيتي كنتي
2012.
2012
So 10 years.
تقريبا 10 سنوات.
Because I want us to be able to provide information to people, but also try to figure out if we can't speak a common language, how can we ever get, I guess, almost to the next level? Like, it's very limited in jobs if you can't communicate with people. Is that right?
هو عم يسأل بطريقته إنه إذا واحد ما في لغة مشتركة بينك وبينهم كيف بدكم تقدروا تحكوا مع بعضكم تتعامل هالعالم مع بعض لأنه لازم يكون في لغة مشتركة.
وأنا أفتهم الإنجليزي. بدي أقول لك أكو قسم مثلا السناب بعدة أسئلة، قسم من الأسئلة أنا ما أعرفها بس ككلام إحنا تعلمنا خلاص الإنجليزية أخذنا نتعلم عليهم أفهمهم ويفهموني.
So as far as communicating in English and understanding like people like talk to each other, I understand it and I speak it. But when it comes to like filling out application that has some technical terms and stuff like that, yeah, it's really challenging for me to understand those words.
Okay. Thank you very much. Any other questions, members? All right. Thank you for your testimony.
very much.
And thank you for your translation. Chair calls Jung Kil Han. And thank you for the translator. So I've got you as Jung Kil Han, self for the bill. Is that correct?
Yes. Yeah.
Yes.
And thank you for the translator. Ma'am, and if you could, we need to hear you as well, so if y'all can share that microphone.
Okay.
And would you state your name? I know you're the translator, so we don't have you.
My name is Hisuk Tyner, Huisuk, last name Tyner, Tyner.
Okay, thank you. And I think you will need to share that because both of y'all are very nice but quiet.
안녕하세요. 저는 한영길이며 홀이온의 지역구 138의 유권자입니다. HB 5166을 강력히 지지합니다. 왜냐하면 영어를 못해서 많은 어려움을 겪어왔습니다. 1981년에 도미하여 청소, 페인트 등 모든 일을 해왔습니다. 2009년에 대장암 수술로 의료비를 직접 내야 했는데 회복 후 일하러 가기 전 6개월간 가끔씩 굶었습니다. 그때 푸드 스탬프로 혜택을 받을 자격이 있는지조차 몰랐고 그러한 혜택이 있다는 사실조차도 한국어로 알려주지 않았습니다. 알았다 해도 지원서가 영어와 스페인어로만 되어 있어서 지원하지 못했을 것입니다. 현재 80세로 최근에 우리 훈토스를 통해 푸드 스탬프를 받게 되었고 만약 신청서가 한국어로 되어 있었다면 본인 스스로가 좀 더 일찍 신청하여 덜 힘들게 충분한 자유를 누릴 수 있었으리라 생각합니다. 제 또래의 많은 한인 노인들이 영어를 못해서 텍사스 주에서 실시하는 혜택을 받는 것이 어렵습니다. HB 5166은 이러한 신청서를 한국어 및 다른 언어로 제공할 때 모든 문제를 해결할 것입니다. 그것은 14년 전에 나에게 도움이 되었을 것이며 통과가 된다면 다른 사람에 도움이 될 것입니다. HB 5166을 꼭 통과되도록 적극 지원을 부탁합니다. 감사합니다.
Dear Chairman Frank and committee members, my name is Young-Gil Han, and I am constituency representative of Lucy Hall in House District 138. I strongly support HB 5166 because I have endured through a lot of hardship because of my limited English. I immigrated here at U.S. in 1981, and I did everything I could do to make a living, such as cleaning and painting. In 2009, I was diagnosed with colon cancer. And because that I had to pay the majority of my surgery medical bill out of my pocket, I had a very little money for left of food. I had to skip meals many times for 6 months before I could go back to work after I recover. The worst part is that I didn't even know I was eligible for SNAP benefit. There is no outreach to me in Korean that such a benefit even exists. And even if I knew, I could not have been able to apply because the application was only in English and Spanish. I am 80 years old now, and fortunately, I have been able to apply and receive SNAP benefit because of Woori Juntos. I now think back and how, if the application was in Korean, I could have applied earlier myself, and I could have suffered less and live life in full liberty and freedom. My story is not unique. There are many Korean seniors who also struggle to receive state benefit because they cannot understand English. HB 5166 could fix all of this in translating this application into Korean and other languages. It would have helped me 14 years ago, and I knew if it passed, it would help someone else. I urge you all to vote yes on HB 5166.
Thank you very much. Members, any questions? Yes, Representative Ramos.
Thank you, Mr. Han, for testifying today, and Ms. Wafa as well. And to go to your, as he mentioned, the SNAP benefits, a lot of the times when we're looking at these applications, as an English speaker, many of us, the applications are still difficult to understand.
저 역시도요, 영어로 돼 있는 그 신청서라도 굉장히 어려워요, 이해하기가. 알고 있습니다.
And as someone who was Spanish speaking my whole life, I would have difficulty reading a Spanish application and filling it out. So I can imagine the reverse is the same. So I'm glad that you found the resources and an advocacy group to help you, and I hope that we do better by our constituents and our citizens here in the state of Texas. Thank you.
Thank you.
Thank you very much. Members, any other questions? All right, thank you very much. All right. At this time, there are no other witnesses signed up to testify. Is there anyone else wishing to testify on, for, or against House Bill 5166? Seeing none, public testimony is closed, and the chair recognizes Representative Morales-Shaw to close on House Bill 5166.
Thank you, Chairman and members, again for having this bill heard and allowing these community members to come up and tell you their stories. I appreciate that. And I just would say that we rely on these people every single day, whether we realize it or not. They are packing our parachute, as they say. I would also like to mention that there's, technology, very advanced technology, that when you call a place, you can select your language and they can they have these services where they just outsource translation. So we don't have to rack our brains or reinvent the wheel because that already exists. And I just want to say, let's make sure that all the hard work that we do every session when we think about these folks and we create state programs, we create health services, we make grants available, we do so much good work. But again, we need to make sure that they have access and it can be delivered and taken advantage of by these hardworking Texans. And with that, if I can answer any questions, I'm happy to.
Yeah, members, any questions? All right.
Thank you, Chairman. Thank you, Madam Chair.
You close?
Yes, I close, and I ask for favorable consideration.
All right, thank you very much. If there's no objection, the bill will be left pending. The chair hears none, and House Bill 5166 is left pending without objection. The chair lays out House Bill 41.